Hi, I'm Sarah. This is my partner Riley that you'll see in a minute. Something that we've been really interested in researching is alternative forms of therapy and how effective they are at improving the quality of life for those who are so near the end of life. A lot of patients in hospice have diseases that affect metabolic pathways such as liver and kidney disease, and that can make traditional medication therapy very difficult for them. And how that medication affects their body. So alternative therapies can be preferable because they are safer and yet hopefully still effective for their care. So in particular, we've been really interested in music therapy. I remember being a little girl and my dear neighbor was on hospice, and I remember going over and to be with her, and this hospice worker pulls out her little travel harp and plays the harp for us. And I remember as one of the patient's loved ones that meant a lot to me and really benefited me, and I think that it benefited her as the patient as well. So that's something that we wanted to research more about. Our PICO question in particular was, in hospice patients, is music therapy more effective at improving quality of care than other alternative therapies?
Hello, and thank you, Sarah, for that great introduction to our research question. So as we began to research music therapy as an alternative therapy, we found several different themes that jumped out at us. Two of the themes that we found from our research articles is first, music therapy can aid with pain management, and second, that music therapy can decrease anxiety. So for pain management, study after study, there were reports that patients were rating their pain lower after music therapy sessions. And while the pain did not completely go away after music therapy sessions, it was resulting in lower pain scores. And patients were reporting about a 10% reduction in pain. So that can be 1 to 2 points lower on the 10-point pain scale. And this shows us that music is having an effect on their pain, but it's more likely affecting the patient's perception of their pain, well, because the pain is not completely going away, but it's helping the patients cope. And this research also proves that the most effective pain management is a combination of alternative therapies, specifically music therapy, with pharmacologic intervention. Second, we also found that music therapy helps with decreasing anxiety. And studies have shown that anxiety levels tended to decrease after music therapy sessions. And this also supports the idea that music therapy helps patients cope with pain, because as anxiety levels decreased, pain levels also decreased. Patients also reported that music therapy helped them with reducing their anxiety, it increased their stress relief, and it improved relaxation. And so when compared to traditional therapy, such as talking, music therapy held up really well against it, and most patients preferred music therapy over talking, and that helped reduce their anxiety more. One nursing application that goes along with these two findings is to provide patients with the opportunity to listen to music whenever they need to. And this can help with breakthrough pain and just managing their pain. Also, it can help whenever they're feeling anxious. So one way that we can make this a possibility for patients is to provide them with headphones. And these headphones can connect to the television in their room. And there could be different music channels on the television. And as the patients and family would come into the facility, they would be educated on how to use the headphones and how to select the different channels so they could listen to their preferred genres of music. And this would, again, allow the patient to participate in music therapy whenever they wanted and whenever they felt like it was most necessary for them. Back to you, Sarah.
So, along with pain management and decreased anxiety, another theme that we pulled from these research articles that we looked at is the benefit of the patient's loved ones and the benefit that music therapy was for them. So, some of the studies that we looked at mentioned the patient's loved ones being also uplifted and calmed by the music. I know in the introduction I kind of alluded to that with my personal experience. A couple of quotes that we really liked from one of the studies. A patient says, "My husband gave lots of suggestions, like the music at our first dance, at our wedding. He really enjoyed it and it really lifted his spirits." Another one said, "My husband thinks music therapy is a bright spark in a dark environment." And it was cool to read some of these experiences that had been recorded of the patient's loved ones and how that could have also benefited the patient in a way, because as they're trying to prepare to leave this life, it could bring a lot of peace to them, knowing that their loved ones are left behind feeling happier and more at peace. So another goal of hospice is to promote spiritual wellness in patients. One study that we looked at showed that patients ranked their spiritual wellness as second priority only after their pain management, and which shows that that can be a pretty big deal to some people. And the patients have a myriad of different spiritual preferences and religious backgrounds that they come from, and music has the benefit of being this universal language that can speak to almost anyone, no matter what their background is, and can help them relate to what's going on. So one of the other themes that we found from our research articles is that music can provide kind of this transcending spiritual experience for a lot of patients. So one study that we looked at suggested that music can help ease spiritual conflict. A quote from one of the patients, they remarked that music therapy helped them get into a higher plane and transcend what they were dealing with. So this idea that they needed to, in order to kind of figure out some of their spiritual conflict, they had to be able to separate themselves from their illness and their current things they were facing, and then music kind of helped them get above that to be able to sort that out. A different study tried to quantify relaxation on a scale, and then measure that with music therapy, and we thought that could relate to spiritual well-being, because that's kind of a hard concept to quantify. But if people are in spiritual conflict, they're not going to feel relaxed. They're going to feel agitated or anxious. They may, and so relaxation could suggest that they're at more spiritual ease. And so this study found that those who participated in music therapy were more relaxed on that scale. And then one other music therapist in a different study talked about the need to be sensitive to different cultures and how music could relate to people in a way that sometimes we don't have the capacity as providers. For example, they talked about a Jewish patient who they were able to play Yiddish music for, and how that helped the patient feel like they were being related to, even if there were maybe no Jewish staff who could do that themselves. One suggestion for how this could apply to the nursing process would be to implement something that would involve the patient's loved ones more in the music therapy. For example, we could give them a survey as their patient starts to begin hospice, ask them different questions about their music preferences, about songs or music that are memorable or special to them, and then we can include those selections of music in their care process. We could have a group of volunteers, of musicians or hospice workers who have differing experiences in music, and then based on the survey preferences, select which ones might be able to help that patient and their family.
As we researched the effectiveness of music therapy in hospice patients, we found 4 prominent themes: pain management, decreasing anxiety, emotional support, and spiritual wellness. Music therapy can be implemented in 2 ways mentioned before. They are first by providing each patient with headphones and the ability to listen to music whenever they want, and also by involving the patient's loved ones in music therapy by asking them the patient's music tastes and for sentimental songs. We found that music therapy is a non-invasive alternative therapy that can really benefit patients who are nearing the end of life.